So I'm with Catherine today at Aneurin Bevan University Health Board at Ysbyty Ystrad Fawr at the new breast clinic here, and it is Breast Awareness Month this month, and so Catherine is going to tell us a little bit more about what we should look out for and how we should look out for it.
So it's good practice to get into checking your breasts from any age. You don't have to wait until you're older. It is useful to get to know what your breast tissue feels like for you, and it's different across different people. So some women naturally have very lumpy breasts, others not so much. But if you're regularly checking your breast tissue yourself, then you will be able to better notice a change early on. And it's really about getting people seen and sorted earlier that gives us the best outcomes when it comes to breast cancer treatments. So the sorts of things that you should be doing is just once a month, do a check of both the breasts and into the armpits as well. Some people will like to do this in the shower or the bath because the moisture helps when feeling the breast tissue. And others will also do that in front of the mirror as well, so that they can see what they're checking and what to look out for. If you do have periods or regular periods, the week after your period is usually the best time to do your breast check, mainly because there's less hormone variation at that time of the month, so you can feel the breast tissue a little bit better, and it will hopefully not be as uncomfortable as well, because some people do get sore breasts around the time of their periods. So the things to look out for would be a lump or a firm area that wasn't there before. The skin being changed, so things like dimples or tethering, so where the skin looks like it is fixed in a little pit or a dimple. The other important symptoms would be your nipple being pulled back into the breast, nipple inversion, or discharge from the nipple that is happening spontaneously. So you might notice discharge on your underwear, on your bra or a top, and particularly if that discharge is bloody, so bright red or brownish in colour, we would be more concerned if it was blood-stained nipple discharge. Interestingly, things like breast pain just by itself with no other breast changes is not commonly associated with breast cancers. Okay. So breast pain by itself is very common, and not associated with breast cancers usually. Breast cancers typically are painless. The websites for Breast Cancer Now and also Copperfield have got some very good information on how to examine your breasts and what sort of things to look out for. So I would strongly recommend those as really good sources of quality information where you're not going to get the wrong information.
What's the first thing someone should do if they have identified any of the symptoms you've just mentioned? What should they do?
Yes, and it can obviously be very worrying for anyone that's found a change. Your mind typically goes to the worst place possible. But I would say try not to panic. Make an appointment with your GP, and the GP will then be able to assess you And if they feel that it needs a review with us in the breast centre, they will refer you onto the breast centre, and we would get you in quickly to be seen.
What are the timelines now for from first seeing your GP to then the next stage?
Yeah, so this is an area that we're always striving to improve. It can vary between times of the year, interestingly. There are some times of the year where we are busier than others. But we do try to see those that have worrying symptoms within sort of 2 to 4 weeks would be the maximum. 4 weeks would be the maximum that we would take to see you. And we do aim to see people within 2 weeks of referral from their general practitioner.
During that time, if they need someone to talk to because they are worrying, are there any support groups locally?
Again, things like Breast Cancer Now have direct support and chat functions that you can use to get support. There are, interestingly, a lot of local support groups for people that have got a breast cancer diagnosis. I'm not aware of any that are for people waiting to be seen. We would typically advise to try not to do too much internet searching and getting panicked by something that might not need to be panicked about. So it does feel like a very long time when you're waiting to be seen in the breast clinic, and we do realise that, and we do try to get people in as quickly as we can do.